In terms of the diagnostic tests, there's no surgical procedures as such. We do a test called a right heart catheter, which is the most invasive of the investigations that we perform here. Although it sounds like a very, very frightening procedure, in fact the procedure is relatively straightforward to perform. And the test itself, a right heart catheter, for the patient, for the individual, involves going into a room with lots of X-ray equipment and a long table with lots of equipment and X-ray boxes and 5 or 6 members of staff. So it looks almost like an operating theatre. And so sometimes when people going into that environment will think that they're maybe having an operation performed, but the reality is all these individuals there and equipment is there to make the procedure very safe. And the procedure itself is very straightforward. And in terms of a surgical procedure, in terms of what we do on the outside, in terms of the skin, it just involves really a very, very small incision of several millimetres. You'll have seen that we give a small injection of local anaesthetic, which is very similar to the local anaesthetic injection that you'll get, for instance, when you go to see the dentist. So that injection itself will numb up the skin and it will sting a little bit. But after that, the procedure should be very painless. What we'd call in medicine a gold standard test. It will give us accurate information on exactly what the pressure is in the blood vessel in the pulmonary artery. Well, we've achieved access in the neck, and this is the Swan-Ganz catheter that we'll introduce through the small tube in the neck. You can see as well that there's a little balloon at the end of the catheter, and that allows us to float the catheter and also allows us to wedge it in the lungs down. And at the tip of that catheter, we can continuously measure the pressure. So what we're going to do now with the catheter is introduce it through the small tube in the neck and then go into the different chambers in the heart, to the right atrium, to the right ventricle, and then to the blood vessel called the pulmonary artery. And what we're interested in here is measuring the pressure in the pulmonary artery and also the other chambers in the heart. What we have there is an X-ray machine that takes pictures of the heart. So when we are initially establishing access in the neck, we want to make sure that we put our small little needles and introducer needles into the right blood vessel. And what we can do is we can put the wire through those little needles to check the position. So it helps in making the procedure much safer. And also the image intensifier allows us, the X-rays allow us to look at the path that our little catheter takes as we go through the heart and into the blood vessels in the lungs. And if we go to the screen there, you can see there are a number of lines. The green line at the top tells us how quickly the patient's heart is beating and what rhythm the patient's heart is beating in. And the yellow tracing in the middle of the screen is the pressure of the blood in the pulmonary artery.